Gentlelady is recognized.
I thank the gentleman for yielding. Mr. Speaker, I rise in support of the Newborn Screening Saves Lives Reauthorization Act. I introduced this bill to help ensure our babies continue receiving life-saving newborn screenings. I extend my sincere thanks to my lead co-sponsor, Congressman Michael Simpson, for his support and his long history of championing newborn screening services. I thank Senators Kay Hagan and Orrin Hatch for introducing the Senate companion bill, which passed by unanimous consent in January of this year. I also thank the coalition of public health groups, especially the March of Dimes and the Association of Public Health Laboratories, for working with my office over the last 10 years on this critical issue. Lastly, I would be remiss if I did not mention Debbie Jessup of my staff for her outstanding management of my bill and the work of two exceptional public health fellows, Ariana Baseman and Daphne Delgado, who provided strong leadership in moving the bill forward. Newborn screening is a public health intervention that involves giving babies a simple blood test to identify many life-threatening genetic and metabolic illnesses before symptoms begin. Newborn screening is one of the great public health success stories of the 20th century. Prior to the enactment of the original Newborn Screening Saves Lives Act in 2008, only 10 states and the District of Columbia required infants to be screened for a complete panel of recommended disorders, and there was no federal repository of information on the diseases. Today, 44 states and the District of Columbia require screening of at least 29 of the 31 core treatable conditions. And today, professionals and parents have centralized access to newborn screening information when their baby is diagnosed with one of these disorders. Since the passage of the original bill, newborn screenings have improved and new screenings have been added. These screenings are critical for the approximately 12,000 babies who each year test positive for one of these treatable diseases. 50 years ago, before newborn screening tests were developed, the conditions of these babies would have gone undetected until symptoms appeared. As a result, they would have unnecessarily died or suffered from their lifelong disabling disorder. Today, because of newborn screening, they have an opportunity and they have hope for a relatively normal life. The ability to rapidly identify and treat these disorders is making a difference between health and disability and even life or death for the children affected by these severe diseases. Unfortunately, critical gaps and challenges still remain. Due to existing discrepancies in the number of tests given from state to state, each year, approximately 1,000 infants tragically die or are permanently disabled from otherwise treatable disorders. The passage of the Newborn Screening Saves Lives Reauthorization Act will help avoid these preventable tragedies by providing states with the resources they need to improve their newborn screening programs and to uniformly test for all recommended disorders. It also provides states with assistance in developing follow-up and tracking programs. These provisions will help our financially burdened healthcare system by saving billions of dollars over the life of these children. In addition, this bill renews the Secretary's Advisory Committee for Heritable Disorders and requires the CDC to ensure the quality of laboratories involved in newborn screening. The bill also continues the Hunter-Kelly Newborn Screening Program, which helps NIH researchers develop better detection, prevention, and treatment strategies. Mr. Speaker, the Newborn Screening Saves Lives Reauthorization Act will continue to help parents and health providers to be knowledgeable about the importance of newborn screening tests, and it will help ensure all our newborn babies receive the comprehensive, consistent testing they need to have healthy, happy, and productive lives. Where a baby is born should not determine its chance to have a healthy future. I urge my colleagues to vote yes on the passage of H.R. 1281. I yield back the balance of my time.
Gentlelady.